Hello, welcome to another episode of Mental Health and Makeup. I am your host, Jasmine Young, a psychiatric and mental health nurse practitioner. And today is Pink Goes Red Day for my sorority, Alpha Kappa Alpha, for heart disease awareness. And so I'm wearing my red. Okay, I'm wearing my red shirt. And so I am going to finish my hair and put my makeup on while we talk about the effects of mental health medications on the heart. All right, so a lot of people say, man, I have diabetes or heart disease, and I have different things going on, and I wonder how my medication for depression is going to affect my heart. So I have a few questions I'm going to answer along the way. And some literature does note that there are cardiovascular risks when it comes to people taking medications for antidepressants. So certain antidepressants can worsen heart issues. And I always will assess a patient for pre-existing heart issues before I prescribe an antidepressant. Some antidepressants like Celexa and Lexapro. Celexa's generic is citalopram, and Lexapro's generic name is S-citalopram oxalate. And I say, doesn't that sound the same? Yes, because Celexa and Lexapro are kind of the same. With Celexa, there are these two compounds, S-citalopram and R-citalopram. And with Lexapro, the makers took the R-citalopram away, and what they came up with, they left the S-citalopram. And that's where Lexapro gets its name. I think I'm going to take that out. I don't know, I've never really liked the middle part. But anyways, so S-citalopram oxalate, or Lexapro, and Celexa are two medications that could affect the heart if someone has pre-existing heart issues. Okay, so if you come in with diabetes or with heart failure or some type of heart issue, I really need to know that. So people say, well, can you prescribe me medicine? Yes, I can prescribe you medicine, but I'm going to prescribe you something that does not put you at risk for increased cardiometabolic side effects like palpitations and skipped heartbeats and things like that. Some of these medications, some of the psychotropic medications have a greater risk for heart symptoms than others, okay? And so we're going to talk about all the different things that can happen with a person who takes mental health medications and how they affect the heart. One group that affects the heart a little bit more than other groups of neuroleptics or medication for the brain are antipsychotics, okay? Antipsychotics like Seroquel or quetiapine, Abilify or aripiprazole. Have y'all ever heard of that? Also, Zyprexa or olanzapine, and ziprasidone or Geodon, Invega or paliperidone, okay? And how they can affect the heart is they can cause increased cholesterol, and they can cause increased blood sugar. And so if you're a diabetic, you know that increased blood sugar affects all your organs, including your heart. And if the medications are going to make cholesterol higher, then it puts you at greater risk for heart disease, atherosclerotic cardiovascular disease, and heart attacks, as well as strokes. All right, so we know that the use of some antipsychotic medications have been associated with obesity, insulin resistance, diabetes, heart attacks, atrial fibrillation, stroke, and death. Okay, so people with bipolar disorder and schizophrenia who are taking antipsychotics or with treatment-resistant major depressive disorder, we always will start with baseline labs, okay? And I'll ask you to either give me your labs from your primary care, the last visit, or I'll just order a complete blood count. I'll order a CMP, a complete metabolic panel, so I can look at your blood work and look at your kidneys and your liver and how well they're functioning. I will also order a lipid panel. And so before you go and get your blood work done, it has to be a fasting panel. So you are not to eat or drink after midnight before you get your blood work done. And the lipid panel includes the total cholesterol, which should be less than 200, triglycerides that should be less than 150, your HDL and LDL, good cholesterol and bad cholesterol, as well as your total cholesterol, which should be under 200. I think I already said that. All right, I will also order some more labs, like vitamin levels. I'd order a TSH, a thyroid stimulating hormone. And that's because some people have thyroid issues, and I need to know that, because when you have thyroid issues, you could have lots of issues with anxiety, depression, heat and cold intolerance, and thinning hair, and lots of other things. And thyroid issues definitely need to be treated before we put you on an antidepressant or antipsychotic. But also, I would order vitamin B12, a vitamin D. I'd order a folic acid or folate. And what else? I always miss one. Oh, a hemoglobin A1C. The hemoglobin A1C, that's for the diabetics out there, or for people who are taking antipsychotics. I need to know a baseline hemoglobin A1C, because that is a measure of your blood sugar, and it's an average. It's kind of like an average over the last 3 months. So if you're ever going to get an A1C done, the 3 months before, and this is for all the diabetics out there, the 3 months before you go get your A1C done, your hemoglobin A1C done, you may want to diet and exercise, just so those numbers will look a little bit more favorable to your physician. But I'm not going to treat your heart issue. I'm not going to treat your blood pressure. I'm not going to treat your cholesterol. What I'm going to do as a psychiatric and mental health nurse practitioner is I am going to refer you to your primary care doctor for them to treat your heart issues. Antipsychotics can make heart disease worse, you know. So if I have someone with heart disease, I may not want to use an antipsychotic. I may want to use something like a mood stabilizer, like lamotrigine or Lamictal, oxcarbazepine, or trileptal, or lithium or Depakote, even though those may make you gain weight. The antipsychotics also, many of them, can make you gain weight. And so if you're sedentary and you don't exercise, and then you have diabetes and heart issues, and then you have bipolar disorder or schizophrenia, you may want to exercise and eat better so you can reduce your risk of cardiovascular effects caused by antipsychotics and antidepressants. And some of my patients that are maybe pre-diabetic, or patients that are taking antipsychotics for schizophrenia, they sometimes have issues with worsening symptoms of heart disease. And that may include bradycardia, which is a slower heart rate, tachycardia, which is a very fast heart rate. Usually bradycardia is anything under 40 beats per minute or under 50 beats per minute, and tachycardia is anything over 100 beats per minute sustained. That just means a fast heartbeat, even at rest. If you have a pulse over 100 beats per minute at rest, it's called tachycardia. Also, hypertension or high blood pressure, hypotension or low blood pressure. And if you have low blood pressure, you could have orthostatic hypotension, dizziness upon standing, and possibly faint. I want to pause and just talk about electrolyte abnormalities, because some people have low potassium levels. And also, if you work out a lot, your potassium levels may get low. Like I went to the gym this morning, and I was kind of having I sat in the sauna, and I was kind of having some leg cramps afterwards. I said, I need to eat a banana, because I was sweating a lot, and we have to replace that potassium, because once our potassium is off, once it's either low or high, lower than 3.5 or higher than 4.5, guess what, guys? We could have some muscle cramps, and guess what's a muscle? Our heart. Our heart's a muscle, and so you could have some arrhythmias, or your rhythm can be off, and you could also have chest pain, chest pressure, shortness of breath, and signs of a heart attack if your potassium levels are off. Okay, some people take potassium wasting medications like Lasix for different reasons. And so if you're taking those medications that decrease your potassium, sometimes you have to take potassium pills. Or you may have skip beats, palpitations, like extra beats, and worsening heart conditions. So sometimes I'll go ahead and refer my patients to their primary care, and then before I refer them, I'll go ahead and just do a full panel. So when they go to their primary care, they will already have that done, and then the primary care can either do an EKG or refer to a cardiologist. It's always good to have a cardiologist. If you have chronic conditions like diabetes and, of course, heart disease, you need a cardiologist. Besides your internist, you definitely need a cardio, okay? And people ask, well, which mental illness increases my risk for cardiovascular disease? Well, any mental illness where you will have to possibly take antipsychotics, like bipolar disorder, schizophrenia, and major depressive disorder. And those disorders are classified as moderate to severe mental health disorders. And people who have moderate to severe mental health disorders actually have a 53% higher risk for having cardiovascular disease than healthy controls, with a 78% higher risk of developing cardiovascular disease. So, which medications could possibly really mess up your heart? Some antibiotics, which is not my area, and antipsychotics, and some antidepressants. So before you take any of those medications, we usually will do a really good history, and we'll ask you lots of questions about your family history, and we'll ask you questions about your medical history. I can never talk and put the liner on at the same time. So when you fill out paperwork, when you first see someone and you fill out initial paperwork, please tell the truth about your health. It's not that we want to punish you or anything. We just have to know what's going on so we don't prescribe you a medication that can make things worse with your heart condition if you have one. It's kind of a weird sound. And people say, what are the long-term effects of antipsychotics? Like if I have bipolar disorder and the only thing that stabilizes my bipolar disorder is an antipsychotic and I have to take it, what are the long-term side effects? Unfortunately, people do sometimes have to continue taking antipsychotics for their mental health stability, and that's where the follow-up and monitoring comes in handy and is extremely important. So as long as you're getting your blood work done, then we'll know when and if we need to stop a certain antipsychotic and go to another. And there are also some antipsychotics that don't have as many metabolic shifts and risk for metabolic changes as others. Of course, those are more expensive, and sometimes they have to be prior authorized by your insurance company. But if you have pre-existing conditions and you can't take that medication and you need something else that's cleaner and has a cleaner side effect profile, I'm going to go to bat for you. And we're going to fight the insurance company. Boom, 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 boom. And hopefully we'll win, because all we have to prove is that it's medically necessary for you to take a medication that's safer because of the cardiovascular risk. All right. Also, the long-term effects of antipsychotics, movement disorders, okay? Movement disorders, and then we have to treat the movement disorders with another medication, right? Also, weight gain. Let's talk about it, because if you gain weight, guess what's affected? Your heart, okay? And so you can see if you have bipolar disorder, or if you have schizophrenia on top of that, it's called schizoaffective disorder. If you have bipolar disorder, schizophrenia, or schizoaffective disorder, or major depressive disorder that will not remit, like a major depressive disorder that just won't stop, then you may have to take a combination of medications, including antipsychotics, okay, for treatment-resistant depression. And that puts you at greater risk for increased cardiovascular side effects, okay, and metabolic side effects. So if you gain weight, that's going to affect your heart. If your cholesterol is increased, it's definitely going to affect the walls of your arteries and your veins, therefore putting you at higher risk for heart attacks and strokes. And so the moral of the story is, people, we have got to, number one, everybody's got to take care of their heart, okay? Everybody's got to take care of their heart. At the same time, we've got to always count up the cost and the risk involved if we prescribe a medication that will affect the heart. Now, there are some medications that are second line that, we can prescribe that are not in those categories, antipsychotics or antidepressants, like mood stabilizers and blood pressure pills. Sometimes we use, if someone has high blood pressure, of course, if you have high blood pressure, it puts you at increased risk for stroke and heart attack. So if someone has high blood pressure and anxiety, I can use medications off label, like beta blockers, like propranolol. Your primary care may use a atenolol, for your blood pressure. And then I come behind them and say, hey, can we use propranolol for that person instead of atenolol? Because propranolol, will also treat their anxiety. I have a really funny story. And I won't say, where the person works, but a lady told me that, their colleagues, she and her colleagues pass around propranolol like it's a controlled substance because it keeps them from being nervous, and they work in front of people, put it like that. And I just laughed and laughed and laughed because I thought that is not a controlled substance, but they're passing that propranolol, that beta blocker, around like it's a controlled substance or a street drug. I'm like, I can prescribe that to you and it's not controlled. So if you are having problems with anxiety, guess what? You don't necessarily have to take Xanax and all the other stuff. We can give you a beta blocker just to calm that anxiety down some. Ooh, that's a lot of black. I gotta fix that. So anyways, I'm gonna fix it. Okay, and while I'm fixing my black mess that I made, man, I like my black though. It's really dark. I also wanted to talk about the possible increase of cholesterol and blood sugar from the antipsychotics. So how would you know if your blood sugar and cholesterol were increasing if you're taking antipsychotics? You wouldn't. So you've got to stay on point with your blood work, okay? So if I say, you've got to get your blood work done, you've got to get your labs done, guess what? Please get them done. Don't procrastinate, because I'm basically looking to see the effects of the antipsychotics on your body, and we want to catch them early. Okay, we don't want to catch them when you're having a heart attack in the emergency room, because then it may be too late. Okay. All right, so I don't want to scare you all, but if you have schizophrenia, if you have bipolar disorder, it is really good to always have an internal medicine doctor and a cardiologist, as well as your psychiatrist or someone like me, another provider, like a psychiatric and mental health nurse practitioner. And the follow-up is very important, because if you fall off the scene and you're still taking medication, or you're symptomatic, you could end up having a heart attack or worse, okay? So people say, well, which medications are best, for somebody with depression, that wouldn't cause like that heart issue, like Lexapro. Well, Lexapro doesn't cause heart issues, but Lexapro may exacerbate heart issues, or escitalopram. Zoloft or sertraline, they're wonderful medications. They're safe and effective. I prescribe them for a lot of different people. And research studies show that Zoloft and Celexa, the father of Lexapro, like the grandfather, both have a lower risk for causing heart issues than a lot of the other antidepressants. Oh, I know I put a dark thumbprint right there. I'll fix that. So we'll start with like a Zoloft 50, and then we'll increase the dose by 50 every time you come back and see me, okay? I want to talk about lastly, I want to talk about the effects of stress on the heart. So I posted on my Mental Health Matters page, Mental Health Matters by Jay Young on Facebook, a phenomenon called John Henryism. John Henryism. Yeah, John Henryism. And just a side note, my grandfather on my mother's side name was John Henry. Long story short, John Henry was working against in Jim Crow South, he was working against a machine trying to get through a mountain. Well, trying to get through some cement, kind of like a railroad. They were making a railroad, and he was trying to help. And so he said, I can work faster than this machine, and I don't care what happens. I'm going to work if it kills me. And that's exactly what it did. He fell dead. He did, do what he had to do, but he fell dead afterwards. And so that was a lot of stress that he put on his body. And unfortunately, black men these days still have to work so hard, harder than their counterparts and other ethnicities most of the time. And I'm not just going to say blacks, but people of color, okay? Like Hispanics and people of color, okay? They're usually having to work really, really hard using their bodies, and that type of stress can increase their risk for heart attack. Also, it increases their risk for sudden cardiac death, heart failure, or abnormal heart rhythms like arrhythmias, okay, in persons who may not even know that they have a heart disease. Okay, so if you have any signs of shortness of breath or chest pain, chest pressure, palpitations, extra beats, you really should get that checked out sooner or later. Put that on your list for this month. Since today is Pink Goes Red Day for the American Heart Association and Heart Disease, I think you should put that on your to-do list for this month to go ahead and get your heart checked out, okay? All right. Well, I can't talk and do the bottom lash at the same time. Hold on. Okay. Also, just stress with COVID. Going through an international pandemic or worldwide, pandemic. It's very stressful. And so you should always work to reduce your levels of stress, to reduce the stress on the heart, because a lot of stress definitely can cause your heart to not work as well. Trauma, like emotional trauma, like the death of a spouse, mental abuse, physical abuse, post-traumatic stress disorder, all that increases your risk of heart attack and or death, okay? So if you're having emotional traumas, I want you all to figure that out, okay? Fix it. Because if you don't fix it, it may end up being the death of you, okay? So I want you all to go ahead and fix your issues, okay, that emotionally stress you out, because I really don't want anyone to succumb to the effects of emotional stress on the heart long term. Get some help, okay? Last thing, I want everyone, when they wake up in the morning before they get out of bed, just to thank your creator for waking you up and helping you to get out of the bed. Did you all know that most heart attacks happen first thing in the morning between the hours of 4 a.m. and 10 a.m.? And why? Because platelets are stickier, and increased adrenaline release from the adrenal glands can trigger rupture of plaques in the coronary arteries. Okay, so if you already have these plugged up plaques, try saying that 5 times in a row. If you already have plugged up plaques in the morning time, they could unloosen themselves and cause a heart attack. All right, folks, I'm finished doing my makeup for the day. And I want to just say that it's been really good coming back. I know I've been gone for a really long time. And so we're finished, and I do want to give a shout out to the Rose to Omega chapter of Alpha Kappa Alpha, our Marietta grad chapter that I am a member of, and I am wearing my red today for Pink Goes Red for Heart Health Day. So I'd like to thank you all for your time, and just remember, be kind to your heart because you need it for a long time. Bye.